Well, I'm Dr. Tyson. I practice in Cape Coral, Fort Myers, and Naples, Florida. My practice is Tyson Eye, and I've been practicing for about 16 years. I'm actually a second-generation ophthalmologist, so I like to call myself a legacy. I was always very much a premium practice, and that's a mindset that you have to have. A lot of people think of their practice as, well, we'll start with the basic and work our way up to premium. So a patient starts on the bottom rung and gets options added to them as they're necessary or available. We think of it the other way around. It's a premium experience from the beginning, and the patient is a premium lens candidate until proven otherwise. So in the beginning, we pretty much only had toric and multifocals, and the multifocals are great in certain individuals, but certain individuals, it's a contraindication. This really allowed us to bring in crystal lens and then later TrueLine to cover areas that were not there. So we didn't see that our multifocal business was being cannibalized by crystal lens or TrueLine, but it added to it. And so we found that we all of a sudden our presbyopia correcting package more than doubled by adding crystal lens and TrueLine in there. And actually TrueLine now has become kind of our go-to toric lens, and then patients shift down to a non-presbyopia correcting toric IOL. So it's really built our practice rather than cannibalized it. All lenses have personality, some good, some bad. What I like about it, it's a very versatile platform. It is not really contraindicated in patients that have corneal or retinal pathology, so it can be used in a wide range of patients. It's going to have some of the best optics out there because it's an aspheric design. Every lens has its little intricacies. This one, when used appropriately, is happy for most of our patients. I mean, we very seldom have an issue. If it is, it's a little bit of residual sphere or a little bit of residual cylinder, and once again, those can be treated because it's a refractive problem. I'm not having to explant patients because it's a waxy vision problem, and so I think that's a lot easier for not just myself, the patient, but also any referring optometrist, because these are things that we know how to deal with. Well, people always tell you, don't work on engineers, don't work on, pilots. Well, I'm not going to put a multifocal in a pilot because I'm so scared of glare and halos. I mean, I know the designs are getting better and better, they're being reduced, but I just can't take that risk. Same with truck drivers. And then, of course, you have the engineer that's going to nitpick everything. So these are the type of individuals where I really find that this lens shines, because I'm telling them, this is giving you the best optic. I go, the worst case scenario is that it's a distance-only lens, but I'm going to be able to give you distance and intermediate, and then over time we've seen that the near vision gets better and better. But I never promise that they're going to be glasses-free. I tell them, you're probably going to need glasses to be able to read things up close. I rather exceed their expectations and wow them. And I tell them when they go, oh, I can read, I'll tell them, that's just bonus. You're just a super patient, So I want to make sure the expectations are right. Most of our patients are now starting to have a more relaxed lifestyle. It used to be that we were dealing with patients that was, their world was, well, I'm retired, I'm going to sit at home and I'm going to sew or I'm going to tie fly fishes, and it was a very up close, very narrow range that they were looking for. Now everything is iPad, now it's the Apple Watch. This is at a more intermediate zone where the crystal lens shines. So the reading glasses, most of our patients really don't understand what the need for them truly are here. They understand that they may need them, but their world doesn't revolve around that anymore. We do such a good job of just kind of letting them know that this is a high-definition lens, that they know they're getting better, they just don't know how much better. And so that's where the real wow factor is. Probably the best was the engineer that came in and was nitpicking the design, wanted to know everything about it, wanted to know how it moved in the eye, what the hinges, how big the optic size. I mean, we had 2 or 3 discussions with this gentleman and explaining, and afterwards, 2015 vision at distance, was nailing the intermediate, and was also sitting there being able to hold it here and say, I can read most of it. So, you find these patients that you're really expecting were going to be the toughest, and then they end up being the ones that are the most appreciative, because they're the ones that actually understand how much effort and time and calculations and precision has to go into this to give them the vision that they're getting.